Hello and welcome to Traditional Chinese Medicine. My name is Christina Kapothanasis. I am a Chinese medicine doctor and acupuncturist in beautiful Honolulu, Hawaii. I'm a graduate of the Shanghai University of Traditional Chinese Medicine, where all of my studies and my year-long residency in an Eastern Western medical integrated hospital were completely conducted in Mandarin Chinese. My mission is to help people integrate Chinese medicine into their daily lives and improve their health and well-being. If you think that this video will help somebody that you know, please share. I have been going through and trying to respond to some of the comments from my videos, and I'm so touched by the lovely comments that you're leaving, so I wanted to share how much they really mean to me. Thank you so much. I also wanted to tell new viewers that I have started an Instagram channel back last Thanksgiving, and I post what I eat every day to encourage everybody to eat a little cleaner for their health, so you can check that out at Chinese Medicine Hawaii. And I am in the middle of working on a course that includes every single tidbit of information and advice that I give my patients over the past 10 years and all the questions that I have answered. So I'm working diligently on it, but I want it to be super quality, so I will make it as perfect as I can before releasing it, and I will put it in the description box below when it comes out, or you can check my website, which I also put in the description box. Okay, so today we're excited for part 3 of our super complicated gal with all of her fun symptoms, and today she gave me the perfect results that I was expecting at her last appointment. She came in and reported that she had no migraines all week. I was a little thrown last week because I thought last week she would give me that feedback, and I had to figure out that the trazodone was causing her headaches. So we had her stop the trazodone, and with all of the headaches leading went all of her other medications as well. So in 1 week we got the trazodone out, her nasal sumatriptan, which she didn't use that frequently anyway, but she didn't need it this week at all, her topiramate, which was the daily migraine prevention, and her phenagrin, which was the migraine pain, nausea, vomiting medicine that she definitely was using last week. So we jumped for joy and celebrated our triumph of migraines are a thing of the past, as long as she doesn't dip her hand back into the avoid foods list. And I took her blood pressure, and I was happy to report that last time I took it, it was 140/105, and today she dropped to 130/100. I know the bottom number is still a little high, but I'm sure that we'll get it as we slowly make her healthier. I was tickled at 10 points on the top and 5 points on the bottom. She continued her powder herbs, even though last week they gave her heartburn because she wanted the ease of powder versus boiling. And I had added Yuzu and Zuru, so this week she reported no heartburn, but she had a stabbing pain in her head for a few minutes after drinking it that went away. And she said it wasn't that bad, and she continued taking it, which I guess is better than her daily 4 to 5 hour migraines that she used to have. But I explained to her that what I think is going on is she's been so dry and hot for so long that the circulation has just stopped in some places, and maybe in some of the recesses of her brain. Now that we're hydrating her and getting the good blood and oxygen to flow there again, I do see that happen in several patients at the beginning. Either the needles will give them a headache just because of the circulation, or Emma's sleeping. Maybe she's going to join us. Or the herbs might do that to them. I've had 2 patients report that this week. So she is going to put up with that for a little bit more, and I'm pretty sure that with time, hopefully a few more days, maybe a couple more weeks, that will go away after her hydration level's better and her circulation is improved. Okay, she definitely avoided her curry powder, which set off her pulses last time, and she's down to only 2 servings of beans this week. And I said, it's fine, you keep your 2 servings of beans if they make you that happy. But the rest of her diet is lovely, and she's doing 3 to 4 cups of vegetables a day, and this week she might add juicing on top of it just to help with the hydration and alkalization. Okay, next. She had a little more energy. She initially reported a 4 out of 10 on her energy scale. She's up to a 5 out of 10, and she felt so energetic that she wanted to try exercising again. So she did 2 days of yoga, and then she started taking evening walks with her husband. But her neuropathy pain has not changed yet, which still is on a 4 to 8 out of 10 pain level, ranging during the day. So if she's walking and it hurts, she stops and she rests. And then she walks some more, and then she stops and she rests and she walks some more. And if it's too painful, her husband goes and gets the car and picks her up. So I said that maybe to start testing her neuropathy pain, we can start by, in a given 60-minute walk or however long she does, how many stops does she need to make? We can also monitor pain levels like that. But I was excited that she had enough energy to even want to exercise, because that'll be great for her circulation. Her night sweats that were daily this week. Come here, sweet pea. Come here, Emma. Join us. Okay, I'll be right back. I'm going to go get her. Okay, Emma's gonna join us. Say hi. Okay, or not. Okay, so we were at night sweats. She was experiencing daily night sweats, and this week she only had twice a week, which she was tickled and forgot, so it was nice that I asked her. Her itchiness level is down from last week at a 4 to a 3, and she was happy to report that she had no palpitations this week. Her sleep made significant improvement. She went to bed at 10:30, and instead of taking 2 to 3 hours to fall asleep, it took 60 minutes to fall asleep, and she slept through until 6:20 a.m. with one-time urination. So she got about 7 hours with no trazodone, and that's much better than 4 to 5 hours with 2 to 3 hours to fall asleep. So that's exciting. We'll have to ask her husband if she is snoring, because it's hard to tell yourself. And her bowel movement, which was so beautiful last time, daily and formed, went backwards. Every other day formed. And I was like, that doesn't make sense at all. So as I asked about her menstruation, which I briefly touched on and said, okay, usually it doesn't come unless you're induced, so I just guessed, well, you're not having it now, right? And she said, I don't have my period now, but I feel super crampy and bloated like it's coming. And I said, oh my goodness, that's so exciting. I really hope it comes. And I asked her, so do you usually get constipated before your cycle comes? And she said, yes. So I'm going to blame those hormone switches that make people drier and sometimes constipated. Some people have loose stools, some people have headaches, and a host of other things. But if her bowel movement goes back to beautiful next week, then we'll know that it was the cycle. And if her bloating and cramping pass and she doesn't bleed, that's okay. At least we're getting closer to her almost having a period by herself. And if she bleeds, then we will jump for joy, because that is only a few treatments and she already has a cycle. That would be awesome. Her tongue was still beautiful, and all of her pulses straight down the line, heart, liver, kidney, lung, spleen, large intestine, were 25%. So basically she's just sort of dehydrated still. But it's better than 0, and it's better than overactive pulses. So I will take that, because at the beginning, after we did the acupuncture, her kidney flipped out. I'm sure she had too many chemical Western medical prescription drugs in her. So now it's all calm, and even after the needles, it was calm. And the needles that I did do were that I added Shenmen at the wrist. So she had Naquan. I don't know the numbers in English, like pericardium number 6 or something like that. I'm not quite sure. But anyway, Shenmen, Neguan and Shenmen, Rangu on the kidney meridian, Gongsun on the spleen, Zulinqi on the gallbladder, Taicong on the liver, Taishi on the kidney, and then on her lower abdomen we did Qihai Guanyuan on the midline, and then Guilai. So last week she didn't want the ones on her abdomen and I wasn't quite sure why, but this week she did, so hopefully I can help her period to push it along a little bit and come. Unfortunately for her herbs, she was allergic to the guiban, but she did get 1 day of it in her and she had loose stools. So we had to go for something else, and she wasn't testing for any of the other kidney yin herbs, but I did get her to test for Bai Shao today. So I thought that's lovely. That will maybe also help her cycle come, and it's getting a little bit of blood in her and it won't be too dry, and I hope. And then because we cannot lose too much blood, if she usually has a long time between cycles, then if she had a 3-day heavy flow of 4 pads a day, that would be extremely heavy bleeding, 12 pads during one cycle. But hopefully if her cycle's coming in a month, it won't be that heavy. I'm not sure if it will still be somewhat heavy just because of the heat in her system, so just in case, I gave her Ojia on the side at 20 grams, and I told her to take that if it looked like her cycle was going to turn into a heavy cycle, because I need to slow that down and keep as much blood in her as we can. Blood is very hard to replenish, and that is too important for her, keeping her cool and moist. We still did cupping on her lower back, and then I am excited for her next week's report, and I will report to you guys as soon as she lets me know how she did, and we'll tell you what we're going to do for our next step. And I'm super excited to put her back together and maybe eventually her end goal of trying to have a baby. So until next time, mahalo, Emma, say bye-bye. Bye-bye. Okay, good job, baby. Good job, pumpkin.
Can you do Nene now?
Yeah.